Good morning. Thank you for joining us today. 6,074 people are currently hospitalized due to COVID-19 in Pennsylvania as of 7 a.m. today. 1,230 of those patients are in the intensive care unit, and 720 are on a ventilator. The trend in the 14-day moving average of the number of hospitalized patients per day has increased by 5,400 since the end of September. Our hospitals and our health systems in Pennsylvania continue to be significantly challenged by COVID-19. Today we are reporting 7,745 new cases of COVID-19, and on Sunday we reported 7,355 new cases. This brings the total number of cases attributed to COVID-19 in Pennsylvania to 563,589 individuals. Of our total cases, the number of people who have recovered from COVID-19 is now at 61%. That number has started to increase again recently. Tragically, 57 new deaths were reported today and 99 new deaths were reported Sunday, for now a total of 13,981 deaths attributed to COVID-19. The statewide percent positivity, as reported on the early warning monitoring dashboard, is now below 16% statewide. This represents a slight decrease from last week. Throughout the pandemic, there have been 44,290 cases of COVID-19 among children 5 to 18 years of age, and close to 12,000 of them have been reported in the last 2 weeks alone. Now, since the first doses of the vaccines have arrived in Pennsylvania 1 week ago, 17,700 healthcare workers have received their first dose. The first 87 hospitals to receive vaccine continue to work to immunize healthcare workers, but it will take some time. This week, we anticipate receiving 30,225 doses of the Pfizer-BioNTech vaccine going to our healthcare facilities. With the approval now of the emergency use authorization for the Moderna vaccine over the weekend, we have been allotted 198,000 doses of the Moderna vaccine, and those doses will start arriving this week. Beginning next week, the federal partnership with CVS and Walgreens will start on-site COVID-19 vaccination services for residents and staff of skilled nursing facilities across the state. These facilities will be receiving the Pfizer-BioNTech COVID-19 vaccine. Operation Warp Speed also has a process in place to ensure that the individuals who have received the first doses of either vaccine are absolutely able to get the necessary second dose. U.S. Health and Human Services Secretary Azar has said that nationally last week 2.9 million doses of vaccine were delivered, and another 2.9 million doses are being held back to ensure that those people get the second dose in 21 days. And the same will be for the Moderna vaccine coming this week. Please remember, as we start the vaccination process, it will still be some months before manufacturers produce enough vaccine to immunize the general public. So that means that mitigation is more important than ever. We still need to wear a mask. We need to wash our hands. We need to social distance. And as we approach the holiday season, we cannot let our guard down. We must continue to follow our personal and collective responsibility to each other to prevent the spread of this virus. In the meantime, until everyone can get vaccinated, we need people to please stand united and wear a mask, wash your hands frequently, stay home, avoid gatherings, social distance, and download the COVID Alert PA app. And as I always like to finish, please stay calm, stay alert, and stay safe. And now I'm pleased to answer questions.
Thank you, Secretary. First up is Sam Zern. Sam, go ahead and unmute yourself.
Urgent cases.
Sam, could you start from the beginning, please?
Of course. With hospital restrictions and a potential holiday surge in cases, how are our hospital systems bracing? And is there any plan for any additional assistance to help them handle a potential surge?
Well, so you are correct. We're approaching Christmas and then New Year's, and it's so important for people to continue the mitigation measures that I just discussed in order to try to prevent a further hospital surge. So the hospitals are working together collaboratively within their health systems, but also between hospitals and health systems on a regional basis to make sure that they have the capacity and the staff and the beds, et cetera, to deal with a potential surge of patients. Our job, really all of our job, is to try to make sure that that surge either doesn't happen or as small as possible.
Next up is Jamie Bittner. Jamie, go ahead and unmute yourself.
Hi, Dr. Levine. If my notes serve me correctly, I believe you said last week we received 97,500 doses of the Pfizer vaccine, but you just said that only 17,700 healthcare workers have been vaccinated. What has happened to the other doses, if I can ask? Are they sitting in storage? Have they been given out to people who are not healthcare workers? What's happening with
Sure. So
doses?
Those doses of the Pfizer vaccine are at the hospitals. Now, they arrived really throughout last week. So it's not like 97,000 doses arrived on Monday. Actually, the majority arrived Thursday, late Thursday, maybe even Friday. And so the hospitals have those, and they're going to be administering them as we speak. You know, the hospitals can only start to immunize when they receive the doses, and a lot of them receive them at the very end of the week. And so they're going to be using them right now, which is why it was so critical that those hospitals that received the Pfizer vaccine have the refrigeration capabilities to be able to keep the vaccine at the temperature that is required.
Jamie, do you have a follow-up?
I do, if I may. There have been some reports of hospitals across the nation were not receiving the correct dosages that they believe they were getting. Either they were receiving too much in some vials or too little. Have we experienced any of that?
We have had no reports of hospitals not receiving exactly what they were told they received through Operation Warp Speed.
Next up is Samantha Ruland from the York Daily Record. Go ahead, Samantha.
Hi, Dr. Levine. Thank you for taking my question. I hope there's not too much background noise right now. But what I wanted to ask you about was, do you have a rollout schedule for when nursing home vaccine distribution will begin? You mentioned how it's starting next week, but I was just wondering how it was going to be prioritized by county.
So it starts on next week. You're entirely correct, and next Monday. And we actually don't have more detailed information about that schedule. That is being coordinated between Operation Warp Speed and CVS and Walgreens, who are working to distribute the vaccines to the nursing homes. We'll be looking to hear from the federal government and from our pharmacy partners more details this week about exactly how it's going to roll out next week.
Great. And then I was just wondering if, based on what we saw with the post-Thanksgiving numbers, and we might see that again now with Christmas, is there a chance that there would be kind of a statewide shutdown happening after Christmas now?
Well, I mean, right now we are seeing certainly a plateau, maybe even a slight decrease in our numbers. Now, it's always lower Sunday and Monday. We'll see how it progresses during the week. But, you know, at the moment we are in our pause PA mitigation measures that are in place that end on January 4th. If everybody does the right thing, if everybody stands united and continues those mitigation measures and pretty much stays home during the holidays, then things look look much more hopeful for January. If people travel, if they have large and small gatherings, then we'll be more challenged. So we'll see how things go.
Next up is Jim Melwart from KYW. Jim, go ahead and unmute.
Just a quick question. Based on the lag between new cases, hospitalizations, and deaths, do you have any modeling and any idea what the healthcare system should expect in the coming weeks based on numbers?
Yeah, so the modeling, through the IHME model, that's the Institute of Health Metrics and Evaluation, the University of Washington, would show increases in hospitalization into the beginning of January and then decreases. So, there's always, as you said, a lag time from the peak of cases to the peak of hospitalizations and then tragically the peak of deaths. So we're going to be watching all of those numbers really carefully, and it'll be very important for the hospitals to be prepared.
And a quick follow-up on that, is there any way to differentiate maybe between a holiday spike and just a natural spike, a seasonal spike of a coronavirus? Can you say, or would you say, that the spikes that we saw in October or in November and December were Halloween and Thanksgiving, or is that just seasonal?
Well, it's very hard to differentiate. I think that probably a little bit of both. I mean, we anticipated a fall resurgence now into winter with the decreasing in temperatures and the spread of a respiratory virus like the coronavirus during that time. But we do think that we saw an increase, certainly because of Thanksgiving. And of course, Pennsylvania is not in a vacuum. We follow the national counts as well. If there was a peak because of Thanksgiving, we'd expect that to kind of be going down now. And then we really need people to follow all of our mitigation advice for the holidays that are upcoming to stop the spread and then to lead to a more positive outcome in January.
Next up is Tyler Pratt from WLVR News. Go ahead, Tyler.
Good morning, Secretary Levine. Thanks for taking the time today. We're hearing, so while the general population, it's going to be a whiles away before they can get vaccinated, we're hearing from people confusion about why people who get vaccines would still need to social distance and wear masks. And I'm wondering if you could drill down in layman's terms sort of how the virus can still be transmitted even if you have a vaccine and the importance of mask wearing afterwards.
Sure. Well, first of all of the vaccines currently available, the Pfizer and the Moderna vaccine, require 2 doses. And so you're only going to be, at best, partially protected after the first dose. Second dose is 3 to 4 weeks later, and to develop full immunity from those vaccines takes several weeks later. So certainly people need to be protected. And then there is no vaccine that is 100% effective. These vaccines in the clinical trials were 90% or more effective, which is amazing. But it is still possible for people to get the coronavirus even though they received the vaccine. There's every indication that it would be much, much milder and not lead to serious illness, but the people still could be contagious. And even if that's 10, 15%, no one knows what the 10 to 15% would be. You might be completely asymptomatic, but still be able to spread the virus. So we will need people until enough of the community is immunized to wear masks, social distance, wash their hands, etc.
And just to follow up on that, it's possible to still have the virus in you with the vaccine and then it gets transmitted out of your nose or something like that. Is that how, can you just break that down a little bit more?
Yes, so it is still possible with the vaccine. You might not have any symptoms, but you still might have the coronavirus and then you would still be contagious. So that is why people will need to continue all of our mitigation factors until we have much more of the whole community that is immunized.
Next up is Erin McCarthy with the Philadelphia Inquirer. Go ahead, Erin.
Hi, Dr. Levine. Thanks again for taking the time today. I know you talked about hospitals getting specifically what they expected in their first Pfizer shipments. Was Pennsylvania as a whole affected at all by Operation Warp Speed's miscalculation of how many vaccines could be shipped this week?
I wouldn't say that we were impacted. We anticipated this. So a week ago Friday, we had a conversation with General Perna regionally, and he told us that the numbers that were in the system were estimates, and it might very well be less. And so when it turned out to be somewhat less, it wasn't different than what we anticipated. So, so we're going to be, and again, half of that vaccine is being held now for the Pfizer, for the long-term care program, and I think I said 31,000 or so doses of the Pfizer will be going out. So we were impacted. I mean, we anticipated it.
And there's been reports over the last couple of days about the coronavirus mutating over in the UK. Are you seeing that at all in Pennsylvania? How concerned, if at all concerned, should Pennsylvanians be about this, particularly with the news of the vaccine coming?
So we have seen no evidence of any significant mutations in Pennsylvania or really in the United States at this time. So we are watching the news out of England, and so we'll see. A lot of that has to be evaluated and studied by virologists, by people who specialize in viruses, to really outline the possible mutations, about the impact of the mutations. So we'll be watching that data really closely. I'm sure through ASTO, the Association of State and Territorial Health Officials, and the CDC will be discussing that. We have calls twice a week, but nothing that I think that people in Pennsylvania have to worry about at this time.
Next up is Flora Pasteur with PennWatch. Flora, go ahead.
Thank you. Good morning, Secretary. Have you or the governor received the vaccine yet?
No, neither of us have received the vaccine, and we're working on those plans.
So you are planning to get it, or can you give us a little bit more information than that?
No, I can't give you more granular detail until it's until everything is worked out. But we'll be working on that this week.
Okay, and
Sorry, go ahead, Flora.
sorry, what is the situation with ICU beds at hospitals across the state? Are you getting reports now from hospitals saying, hey, we are out of ICU beds? What's the situation?
Well, certainly our hospitals and health systems are strained, and we look at that on a regional basis through our healthcare collaboratives. The region that has had issues in terms of staffing consistently is the Southwest. South Central has had at times some issues with staffing, but we're watching the bed capacity. So there are, we get a report every day of different measures that hospitals have to take to be able to deal with the load of COVID-19 patients. But they're doing exactly what they need to do. They are shifting capacity, they're shifting staffing, they're shifting resources to deal with COVID-19 patients and non-COVID-19 patients, and that includes an intensive care unit capacity. Sometimes they're opening up other units to take COVID-19 patients. Right now, our healthcare system is doing what it needs to do, and it is coping.
Next up is Tom Lehman from WGAL. Go ahead, Tom.
Can you talk about the concerns when it comes to testing and sort of, I guess, the wait times for getting some of the results back? When you're talking about the holiday coming up, people want to know whether they're negative or positive, and some of the larger concerns beyond that, just beyond the results.
Sure. Well, we continue to have robust testing capacity in Pennsylvania. We're getting, on average, approximately 70,000 test results per day. There are some decreases over the weekends, and we always anticipate that. But you're right, for testing that goes through national laboratories, such as Quest and LabCorp, there is a several-day wait to get test results. If the average is several days, then sometimes it's longer, and that can make it really challenging for patients. We really want people in general to stay home for the holidays, not to travel outside of Pennsylvania, not really to travel within Pennsylvania. Please stay home, stay within your household, speak to your family and friends through remote media, and stay the course through this very challenging winter as the vaccine will be rolled out in the new year.
Next up is Mark Hall from ABC 27. Go ahead, Mark.
Good morning, Secretary. Thank you for your time. Again, we have, and I know you've really touched on it often, but again, we have Christmas coming up this week and, of course, New Year's. I know you can't stress enough the importance, you just talked about it, of staying home. But again, just touch on it, because
sure.
next Christmas and next New Year's could be much better than this year. Talk about that.
Absolutely.
If we all do our part.
Absolutely. So, there is a light at the end of the tunnel. We have now 2 safe and effective vaccines that are being rolled out as we speak. Right now, healthcare workers in Pennsylvania are getting the vaccine. They'll be getting their second dose in a number of weeks. And then we have the new vaccine, Moderna, with 190,000 doses coming out this week for more healthcare workers. They'll get their second dose in 4 weeks. We'll be working through the different phases as outlined by the CDC. And so there is absolutely hope for the future. But right now, the challenges still remain. COVID-19 continues to be a real threat for Pennsylvania and for our nation. And there are 3 ways to cope with to address the pandemic. Containment, we've talked about that. Mitigation, and the vaccine. Right now, we need people to continue those challenging mitigation efforts, those sacrifices. And with this holiday, we need people to stay home. We need people to stay within their home and their household and to interact with others remotely. And the same thing for New Year's. And as we do that, over the next number of months, we will see a brighter future as 2021 continues. And then next year at this time, things will look so much better. But right now, please stay the course.
Thank you.
Next up is Nicole Brambilla from LMP. Nicole, go ahead and unmute.
My apologies. I think I was a little too quick on the trigger. Thank you, Secretary, for taking my question. Why is it that we don't know how many doses precisely are going to be going to CVS and Walgreens?
So I don't have it in front of me. We know how many doses they're going to get, certainly in terms of the Pfizer vaccine. They're going to be, the long-term care mission with CVS and Walgreens is with the Pfizer vaccine. So that was our choice because of the different storage requirements and those pharmacies' ability in their distribution centers to be able to handle the refrigeration. And we know how many doses we're going to get. What we don't know from CVS is exactly how they're going to be distributing those doses. And so I don't have any granular detail about exactly where they're going on Monday, Tuesday, Wednesday at this time. We'll be looking to Operation Warp Speed and CVS for that information as the week progresses.
Did you, I'm sorry, a quick follow-up. Did you share earlier, because if you did, I missed it, my apologies, how many doses of Pfizer vaccine are going to be? Because when I asked CVS this morning, they referred to me to you. And when I asked your press folks that, they referred me back to CVS. So it's a little frustrating.
That type of information will be coming out later today.
Thank you.
And we're working on a dashboard. I don't know exactly when the dashboard will be available, but we're working on a dashboard that will have much of that information. That'll either be available at the end of the week or by next week.
Next up is Paul Go from the Pittsburgh Business Times. Go ahead, Paul.
Thank you, Dr. Levine. Thanks for taking the time. My first question is, how is the Moderna vaccine being distributed? Is it going to the same hospitals, or are there more because the refrigeration requirements are fewer?
It's going to be going to more hospitals. Again, we're getting quite a few number of doses, and it's going to be going widespread to hospitals. That information about exactly which hospitals should be available later today on our website, because we will be posting that. But that is why we chose the Pfizer product for the nursing home and long-term care mission, because we want to be able to have the Moderna vaccine go to, for instance, rural hospitals that don't have the refrigeration capability. And so it's going to have widespread distribution over the course of the week. It doesn't just come out on Monday. And so I think that that's an important point. So it's not like they get all the doses on Monday. We have no say in terms of how Operation Warp Speed and the transports the vaccine to the hospitals. That's all handled by the federal government. But it's going to go out over the course of the week. And we'll have which hospitals on the website later this afternoon.
Thank you. And then the other question is about the decision process regarding January 4th and whether to continue those. What will be some of the things that you'll be looking at? The same things you've been looking at all the time, or will it be a combination?
Well, we're going to be looking at all the data that we continue to analyze. We're going to be looking at our incidence rates. We're going to be looking at our percent positivity rates this week and then into next week. We'll have all of that information together. We will present it to the governor, and the governor decides.
Next up is Paul Abdullah from the Keystone. Go ahead, Paul.
Thank you for taking time to answer my question today, Dr. Levine. When you talked about the number of younger, like children who are getting testing positive recently, where do you think that's coming from? And do you think that's something you're concerned about?
We're very concerned. We continue to see cases of MIS-C, or multi-system inflammatory syndrome associated with coronavirus in children. Children can get quite sick from coronavirus. So, I mean, we're seeing different ways that it's spread. It is still, again, widespread community transmission. We know that small gatherings, so birthday parties and other types of parties is a source of spread. School can be a source of spread, especially for the older kids in high school more than the younger children. In addition, we know that activities such as indoor sports, as well as something like Glee Club, Drama Club, those type of activities cause the spread. So there's a number of different ways that children can contract the coronavirus.
Thank you.
Next up is Anthony Orzoko from WITF. Anthony, go ahead and unmute.
Thank you, Secretary. As we've seen, the coronavirus has disproportionately affected communities of color. And also, we have seen recent studies that show that Black and Latinos are less likely to be trusting of a vaccine. I'm wondering if there are any efforts that the Department of Health is doing to either raise awareness or to encourage Black and Latino communities to take the vaccine.
Sure, yes. So it's very, very important that we have a very clear health equity lens with which we look at vaccinations. So when I say healthcare workers, I know people tend to think of doctors, nurses, et cetera, but we're looking at healthcare workers for vaccinations very, very broadly. So custodial staff will be healthcare workers. People, the individuals in hospitals that bring us our meals, those are healthcare workers. Outpatient staff are all healthcare workers, and of course EMS is all healthcare workers. So we're going to many of the workers, as we look at it broadly, will be in those minority groups, and so they'll be getting immunized in that phase. In addition, many individuals that work in the long-term care facilities are minority vulnerable populations, and they will be getting the immunizations that way. And then we're looking forward to the publication of the CDC Advisory Committee recommendations for 1B and 1C in terms of quote-unquote frontline workers and seniors. The exact details should be coming out hopefully today or tomorrow. And many of the frontline workers involve those communities. So it'll be really, really important to have that health equity lens. Finally, we are hopeful that the federal government will pass the stimulus package today, and what we've been told is that includes money for the vaccine program for the states, territories, and cities, and then we'll need money for our education campaign to be able to really use local leaders to help us with communities to try to make sure that, as you've pointed out, those vulnerable populations and minority populations are immunized.
Thank you. And our last question today, Bill O'Boyle from the Times Leader. Go ahead, Bill. Bill, go ahead and unmute. Okay, Bill seems to be having technical difficulties. We'll go to Bill Kibler from Altoona Mirror. Okay. All right, Secretary, it looks like that is it for our press conference today. Thank you for joining us. Recording of this broadcast will be available on PACast later today. Thank you.